This is the James Cancer-Free World podcast. I'm Steve Wartenberg, and my guest is Dr. Marisa Bittoni. Marisa is a scientist and researcher in the oncology division of the College of Medicine. Her research focuses on how lifestyle choices such as diet, exercise, and smoking can impact the risk of lung cancer. Today, Marisa will fill us in on her new research that has shown that the combination of smoking and vaping greatly increases the risk of lung cancer. Welcome to the podcast.
Thank you. Glad to be here.
So before we dive into your new research, give us an overview on the bigger picture of your big package of research.
Okay, well, like you said, so I'm a research assistant professor in medical oncology at the James, and my research focuses on lifestyle factors, including diet, exercise, smoking, and the effects on lung cancer risk and survival, and especially looking at the relationship like on inflammation and biomarkers of cancer risks, and also effects with the microbiome. So we've incorporated that in recent
Microbiome
studies.
is what's going on in your gut.
Yeah, the gut, right, gut bacteria, yes. And so incorporated that in many of my studies. Currently running a couple intervention studies. One is that I'm principal investigator on is the BFIT study, which we are looking at. It's an exercise intervention looking at the effects of exercise and reducing lung cancer risk in long-time smokers. So these are smokers from 20-pack years within the last 15 years between the ages of 40 and 80. We actually are still recruiting, so I welcome any new participants. Could always contact me. So yeah, we're looking there at inflammation and microbiome.
So when you say inflammation,
outcomes.
that also equates to someone's weight and obesity?
Well, yeah, obesity is a form of inflammation in the
Right.
body, actually. So yeah, when you reduce the obesity levels, you do reduce inflammation automatically. But we're looking more specifically at blood markers. When I say inflammatory biomarkers, we're looking
okay.
at blood markers like CRP, IL-6. And the effects there, and then also the effects on the microbiome and those interrelationships.
So if you understand the effects on the microbiome and how that can increase your risk of lung cancer, what can you do? Or what do you have enough information to know what people should eat and how they can have better microbiome profiles?
Right. Well, yeah. So the one diet, we did do a diet study. We actually looked at a black raspberry beverage that was developed at Ohio State. So black raspberries do have anti-cancer properties, and so that was one study that we did, and we're working on publishing the results. We did find some effects on the microbiome and lung cancer risk. So looking at improvements in the gut bacteria. So these are early markers of lung cancer. I mean, it takes a long time to get lung cancer. So what we can do now with these prevention studies is just trying to look at the early markers. So we know if we can reduce inflammation and improve the gut bacteria, then we believe we can, we're also reducing the cancer risk.
So if you see the markers, the early markers, I'm guessing that stopping smoking is something you would advise, but what do you tell people who have these early markers? What can they do to hopefully not get lung cancer?
Well, improve the diet. I mean, that's always, the berry drink, that I believe that was the equivalent to a cup of berries was in that drink, and that we had a juice box.
The black raspberry.
The black
drink.
Raspberry beverage. It was developed at Ohio State and donated berries from a local farmer, which I believe was about a cup per, they drank 2 juice boxes a day, and it was about a cup of berries in there. So berries are like a superfood. They have so many, good properties,
Right. Yeah.
and including anti-cancer properties. So that's one reason we did that study.
But where does the encouraging people to stop smoking come in? Is that hard to get people to do because it's so addictive?
Yeah, that is very difficult to do. I mean, smoking is the predominant risk factor for lung cancer. 85% of people with lung cancer are smokers, but there's 15% that aren't. So there's also a group there that, it's related more to genetics, possibly environment, could be diet and exercise. I mean, there's a lot of factors that play into this. And yeah, smoking is highly addictive. So if we could get everyone to stop smoking, we we would see so much less disease in our country and in the world. But it is difficult. So that's why we look at these other modifiable risk factors, such as diet and exercise. But, anytime you quit smoking, your body starts to repair itself and does a lot of good things automatically, but it is difficult for people to quit. It's very difficult
for us. So. I'm a non-smoker, and I don't fully understand it, but it's so addictive that your body craves it, and it's so hard to get people to stop, but that's so important. So.
Yeah, it's a challenge for sure. But if we can find other ways to reduce risk, even if they are going to continue to smoke, that's why we're doing these types of lifestyle studies on diet and exercise, because we have found that diet and exercise can have a large impact on cancer risk as well. Yeah, people don't realize how much, but there is quite a bit. Yeah.
We're going to take a quick break, and when we come back, we'll talk about your more specific research on the combination of smoking cigarettes and vaping and how that increases the risk of lung cancer.
The best outcomes for treating cancer come from early detection and early diagnosis.
The James Cancer Diagnostic Center at Ohio State
is designed to provide rapid evaluation and a clear diagnosis.
We are transforming care by giving patients direct access
to cancer experts who study and treat cancer every day.
If you think you have cancer, the choice is clear.
Choose the James Cancer Diagnostic Center.
We're back with Marisa Bittoni, and let's talk about this research that looked at the combination of smoking regular cigarettes and vaping. First, where did the idea come from that you were going to research and see if there was an increase in lung cancer?
Okay. Yes. Well, one of my colleagues, longtime professors in public health and mentors, Dr. Randall Harris, was actually approached me. He's the lead author on the study as well as corresponding author. And he approached me, with this idea of looking at the medical records and to do this case control study, because there's really no published evidence on the effects of vaping directly on lung cancer. So
yeah, because it's sort of a new area of research.
Right. Well, it's because vaping is so new.
Yeah.
And lung cancer takes years to develop, so we're not seeing the effects yet. I mean, it takes 10 to 20 years probably to see.
I hadn't thought of that, but
see the effects.
It's too soon to fully understand the effect.
So to do a prospective study where we follow people, that takes a long time. So this is a way of looking at people who already have cancer. In a case control study, you look at the cases, and then you find a comparable control group that is very similar, except for what you're studying. We looked at the electronic medical record data at Ohio State at the James Cancer Hospital. And so we did it's like a matched case control study. So a 5-to-1 match, looked at all the lung cancer cases, which we had about 5,000. And then we did a 5-to-1 match. So we had about 25,000 controls. They were from OSU hospitals, but non-cancer cases. And so that's the comparison group that, we compared those cases to the controls. They were matched on gender, age, year of diagnosis, and county of residence. So those were the matching factors.
So you start crunching numbers and putting data together, and what did you find?
Right. So, we had some telling results, actually. So I will say that we did not have enough people that only vaped, to have a separate group. So that's why we compared people that, so our comparison really ended up being people that only smoked and the people that had smoked and vaped.
Okay.
Yeah, because we just didn't have enough. But, we hope to do some follow-up and try to get that group as well in the future. But, so for the purpose of this study, though, we did find some big differences between those who smoked and vaped versus vaped. So the group that both smoked and vaped had 4 times higher risks than the group that smoked only.
Risk or actual? They had
their lung cancer. So their risk of lung cancer. We use a measure called the odds ratio in a case control study. So we really look at the odds of having cancer, developing lung cancer, and these cases versus the controls was in the order of. So what we'll say is, so the smokers had an odds ratio of about 9 or 10, which is about normal for a smoker versus a non-smoker. But so what we found was the smokers still had a ratio of about 10, a risk of smoking, of developing lung cancer if they smoked. But the people that smoked and vaped had odds ratios of closer to 40. So that was 4 times higher. So that's huge. Those are huge risks.
Wait, first explain that first, this rate, alt rate, did you call it?
Odds ratio. That's the measure, the statistical measure that we use to estimate the risk of, developing lung cancer.
And for people who smoked only, it was 9 or 10.
Yeah, that was 9 in our study. It was 9. This was for even controlling for like COPD and for heart disease, which are also kind of related. So we want to control those factors. So even taking that out of the equation, yes, so people that only smoked had a 9 times higher risk of lung cancer than people that didn't smoke.
And people who smoke and vaped had a 40?
40, almost like 38 times higher. Yeah.
Wow. So
yeah.
What does that mean? Like, I'm guessing it might be too early, but what is it about the combination that would increase the risk by 4 times? Is there a way to even know at this point?
Right. Well, yeah, these are early results, and I mean, it's what we think is a dual exposure. I mean, they were exposed to two different types of these carcinogens, or because even vaping has nicotine, and it also has a lot of chemicals in there.
And it's heated, right?
And it's heated. Yeah, there's like a battery there that heats the liquid, and that causes creates the vaping and the heated liquid. But there's a lot of also carcinogens there. So. They're getting actually like this double exposure. What we don't know, what one of the limitations of the study is that, we need to better quantify these, the smoking and the vaping, and whether, which occurred first, and how long did they vape before they smoked? Did they switch? Did they stop smoking and vape? We need more information on that. We didn't have a lot of that temporal information.
So it almost sounds like, if we went back, I'm not even sure how many years, I'm going to say 40 or 50, when you first were able to prove that smoking increases your lung cancer risk, and that opened up a whole silo of research that is now in 40 or 50 years. You're at the forefront of a new area of research, is what is vaping do
the
in terms
effects of vaping.
So you're really at the pioneer in this area. So I'm guessing that for the rest of your career, you're going to be looking at this.
We figured this would start, hopefully start this new wave, and people would see this
all over the country, not just here.
Oh, yeah. And I've had, we've had so much, so many requests, and questions. And so we wanted it to spark something, and hopefully others could do more. And, you don't just go by one study. You have to confirm and corroborate the results. So,
that's what I was going to ask. When you say you have to confirm and corroborate, you're going to be doing further research to confirm and corroborate. And other people will, because they want to test your results and see if they get the same. And if that happens and people keep confirming that, could that change regulations in some way? Like what will this research lead to? Like in however many years it takes to really fully understand it.
Yeah. Well, right now, the tobacco industry, they want to promote vaping. Yeah. I mean, they make a lot of money off of it. But obviously, since there is no evidence, they've taken that and said, trying to say vaping is safer than smoking. We don't really know that, or this harm reduction approach, which some have touted. Even some doctors might recommend it, because there have been some evidence that people have been able to quit smoking by vaping.
Right.
But without evidence, we just don't have the evidence.
Evidence that vaping is safer.
Yeah. There's no evidence that it's safer.
It's still too soon to know.
Right. Yeah. Right. And so until we can do these longer term studies, or have more of these studies like what we just did with better evidence, better smoking, better data, and quantify that better, then we can start to make better conclusions. I did see in the American Thoracic Society conference, they had results similar to ours. I don't think they had published them yet, so people are probably doing the research. They're just not published yet. But I have seen a couple things, and I've seen more with practitioners saying we maybe we shouldn't really be recommending vaping over smoking as a method to quit, because we're just not sure yet whether it's really better,
Yeah, that's why we need science.
Right. So yes, plan is to continue and do some follow-up.
Well, that's what I was just about to ask. What is, well, there's probably several, but what are one or two of your follow-up research projects going to be?
Yeah, well, first of all, we're going to go back to the people that were in this study, to the cases again. Hopefully, we can get the controls and get enough controls to respond as well to get a better measure of the smoking. Like I mentioned, the temporal, how long they did each, when they did it in relation to the other. We just want to tease out all those factors and really look at this combination and what's there. Hopefully, we can get a vaping only group and get just people that only vaped. Okay. And I think as time goes on, we hopefully will have more.
Yeah, that's true. People who are probably in their 20s now may have started and only vaped and may hardly ever or never smoke cigarettes. That's a whole new group to look at.
And that group is basically untapped because they're not going to have lung cancer yet.
Well, I was going to ask you why this research is important, but you said you've looked at 5,000 people with lung cancer. Mm-hmm. That's why it's important. 5,000 people who probably don't have a good long-term prognosis. So it's vital.
Right.
But you tell me why. I think I answered, but why is this vital to better understand?
Oh, yeah. I mean, because we don't want to tell people, to vape, and it's better than smoking if it's, and it's really prevalent. And, I hear like high schools and young adults, and, it's really prevalent.
Because they market to these young adults.
Right. And the flavors and all, they try to make it really appealing, and the packaging, so... they're going to make money, the best they can. I think it's important for practitioners to be delivering the right messages. That's why it's so important to do this research and make sure that the right messages are being delivered, because people tend to listen to their, physicians, whether it be your primary practice doctor or if you're a longtime smoker, you've probably been in to see a pulmonologist. So because it's unknown, I think people are giving different messages and aren't really sure what message to give. Yeah.
So we're starting to better figure out the message and understand. So it's kind of obvious you're pretty passionate about this and you've dedicated your life to this. So what drives you to do that?
Oh boy, I've been doing this this type of research for a long time. I mean, with lung cancer, I've been about the last 10 years, but I mean, so my whole career pretty much has been looking at risk factors and prevention of lung cancer, and also for survival. Increasing for people that already have cancer. That's another form of prevention is keeping it from getting worse. So increasing survival, and we do have more survivors these days. Because we have better treatments, better screening.
So it's better understanding which treatments work better for certain groups of people.
Not necessarily which treatments, but to keep people living longer, like improving their diet and exercise. So even people that have cancer, or while they're undergoing treatment or even after treatment, if they can improve their lifestyle, they can live longer. So
that's the message for everyone starting at an early age. And better lifestyle choices can extend your life and prevent so many different kinds of cancer.
Oh, right. Yeah. I mean, there was estimates that about 30 to 40% of cancers could be prevented with lifestyle modifications.
Which is diet, exercise, not smoking, limit your alcohol.
Yeah.
Are we missing anything?
Those are the big ones, I would say. Right. So.
Okay. Well, thank you, and good luck in your continued research and getting the word out there about the dangers of combining smoking cigarettes and vaping.
Okay, well, thank you for having me.
This podcast is brought to you by the Ohio State University Comprehensive Cancer Center, Arthur G. James Cancer Hospital, and Richard J. Solove Research Institute. For more information, check out our website, cancer.osu.edu.